Welcome to Psych Talk for primary care providers, where our esteemed faculty members will provide you with invaluable insights to seamlessly integrate into your daily practice. Today, we will have Dr. Jody Rawles talk to you about electroconvulsive therapy, or ECT. There are many misconceptions about ECT, but it is safe and effective.
My name is Jody Rawles. I'm a professor of psychiatry at UC Irvine. I've been there a little over 20 years. And when people ask me what's my specialty or expertise, I generally tell them I'm an acute care psychiatrist, which means that I work in a hospital setting, taking care of hospitalized patients suffering from acute persistent mental illness, such as severe depression, schizophrenia, and bipolar disorder. And so what I want to talk to you today about is electroconvulsive therapy, sometimes known as shock therapy. Obviously, maybe not the most polite term to use or describe this treatment, but that's what I'm here to talk about, is to give you some background on the history of electroconvulsive therapy and how it's used and what illnesses it treats. So ECT, or electroconvulsive therapy, has been around for almost 100 years. Basically, 1920, 1930s was the beginning of ECT, and it's gone through many iterations of improvement. So people may be familiar with media presentations from movies, television programs about this treatment, and it's not often depicted in the most favorable terms. And so part of what I'd like to let people know is it's a very safe treatment. The most common misconception is that it's going to erase your memory or damage your brain. And in general, most people's memory is actually better after it, because the experience of being depressed leaves you inattentive and your mind is not working. So the fact that this successfully treats your depression actually makes you more attentive and more focused afterwards. It's a very safe procedure. It can be done in minors, 15, 16-year-olds. It can be done in pregnant women. It can be done in, grandparents, 60, 70, 80. I think the oldest patient I've ever treated is 93 or 4 years old. Because you're medically monitored by an anesthesia team during the treatment. And you're not even actually having a full seizure, and that medications are used to block your muscles so that if someone were to watch you having ECT, you're not moving around. The reason we still do ECT, some people will look at us and go, isn't that kind of barbaric? I can't believe they're still doing it. Is it's actually the most effective treatment for what we call unipolar depression, or just typical depression. And so when you have a patient who's severely depressed, suicidal, and has been tried on multiple medications and has not gotten better, ECT is the single best way to take care of them. Almost 80% of the people who get ECT feel better and probably don't need additional treatment. And sometimes they don't even need medications afterwards. So it is a hospital-based procedure. You do have to go under general anesthesia, but the whole procedure takes only 15, 30 minutes from beginning of, getting your medications to help you relax to waking up and being ready for discharge. Now, most places will make you stay about an additional 30 minutes for a total of an hour to make sure there's no after effects of anesthesia. But if you have a treatment at, say, 7:30 in the morning, you could be home by 9 o'clock in the morning. Most people get somewhere between 6 and 12 treatments over a course of 3 to 4 weeks. And most people will get a substantial improvement in their depression. Sometimes people will require what we call maintenance ECT at the end of, maybe 6 to 12 months afterwards, a booster treatment. But some people do fine without any additional treatments. The most common indications for ECT would be unipolar depression or severe depression, bipolar disorder, mania, and then also a condition we call catatonia, which is a severe state of anxiety where people get frozen and locked up and unable to do much of anything. Sometimes these people are admitted to intensive care units at the hospital because they're so frozen they won't even feed themselves or move. And ECT is sort of the second tier. Right? We sometimes can treat these patients with medications, but frequently if the medications are ineffective, electroconvulsive therapy, or ECT, is the most effective treatment for this. Again, there are other interventional techniques in psychiatry, such as TMS, ketamine, infusions, and other emerging modalities, but ECT remains the gold standard. Something like TMS or magnetic therapy, as some people may have heard about it, is an emerging technology that is an alternative to ECT. And the nice thing about it is it's less invasive. It doesn't require anesthesia, doesn't require as much preparation, but it does require more visits. It requires somewhere between 20 to 30 visits in an outpatient setting. So there are pros and cons of these two techniques. I do think that TMS shows a lot of promise, as the technology is still in its infancy compared to ECT, which has been around about 100 years. TMS has been around maybe 10 years and is really still in its steep incline in sort of improvements from year to year. In conclusion, I want people to get a take-home message that if you or your loved one is suffering from a severe mental illness and not getting better with conventional treatment, and a practitioner is recommending ECT, you should understand that this is a very safe and effective treatment, and you should consider it.